Good morning, good afternoon. My name is Sabine Rakoto Malala. I work for the Global Partnership to End Violence Against Children, and I'm outposted in the World Health Organization in Geneva, Switzerland. First, I want to thank you for listening in to the webinar today on how to end violence against children and how the Inspire technical package can help with ending violence against children. Before getting into the technical package, I want to give you an overview of the huge problem of violence against children that we're talking about today. We know that globally, up to 1 billion children have experienced physical, sexual, or psychological violence in the past year. That's 1 out of 2 children across the world. North, South, East, West, high income, middle income, low income countries have all been assessed through household surveys, demographic health surveys, school-based surveys, and this is the data that we're getting. If we break down the data, we see some important nuances. We know that 1 in 4 children suffer from physical abuse around the world. We see that nearly 1 in 4 girls is sexually abused at least once in her lifetime. Homicide is among the top 5 causes of death in adolescents. 80% of homicide victims are boys. So whereas we put a lot of accent on women and girls, we see that boys are also very much affected by violence. And beyond these deaths, tens of millions more children are affected by violence every day around the world. What is the type of violence we're talking about? We're speaking of violence up to the age of 18 and sometimes older, youth violence. So child maltreatment, which happens across the lifespan. Bullying, which starts often in primary school and secondary school. Youth violence, which happens as of secondary school. Intimate partner violence, which we sometimes call dating violence, as of 12, 13, 14 years old. And then sexual violence, which is across the whole lifespan as well. Emotional or physical violence and witnessing violence is something that occurs a lot. We know that children that are witnessing violence are often also subject to violence themselves. And we know that children witnessing intimate partner violence in their home may also be more likely to be perpetrators of violence later in life. So these are all the types of violence that we're speaking about over the next 15, 20 minutes. So we've looked at the magnitude and a breakdown of the types of violence that affects which types of children. I just want to present one slide on the consequences of violence against children in terms of health consequences. We see that violence has an impact in terms of injuries, head injuries, fractures, burns, and internal injuries. We see that it has an impact in terms of risk behaviors, obesity, physical inactivity, alcohol, smoking. We see the direct health consequences in terms of alcohol and drugs, HIV/AIDS, sexually transmittable diseases, unsafe sexual practices. The more obvious direct health consequences are unintended adolescent pregnancy, pregnancy complications, and then the ones that we refer to often in terms of the impact of violence against children are around depression and anxiety, suicide, post-traumatic stress disorder. If you look at the bottom right slide, the part of the slide, you see also the indirect effect due to adoption of high-risk behavior. We've seen more and more linkages between violence against children and diabetes, cancer, chronic lung diseases, and heart diseases. So now we've looked at the prevalence and the health consequences of violence against children. I just want us to look together at the response. To date, violence against children has been addressed very sporadically in different ways by different organizations. Previously, if you would ask UNICEF on how to address violence against children, they may say working with the social service sector or strengthening the child protection system or working with the education sector. Another organization such as PLAN would say, no, maybe it's more on income generation. Save the Children could say it's more about cognitive behavior therapy. I'm giving examples of different ways that organizations have been addressing violence against children. So it's really been different organizations speaking with different voices. What we're trying to achieve since a couple of years is collective impact, is to try bring organizations, people, and communities together to be speaking the same language, to be singing from the same song sheet. In order to achieve collective impact, we need 6 core elements. We need a clear logic model. What are we trying to achieve? We need a technical package. We need monitoring components, we need partnerships, we need communication, and we need political commitment. Now, all this may seem very theoretical, but it really does have an impact. And Inspire, this core document that we'll be talking about, is the technical package that we're focusing on. And I will give you some very concrete examples of how Inspire can be applied within your setting. So Inspire was launched in 2016 by the UN General Secretary at the time, Ban Ki-moon, along with the Executive Director of UNICEF and of WHO. And it's made up of 3 documents. So you have the core Inspire package and the handbook and the indicator framework. And I'll go into each of these in a bit more detail. Again, this document is not just a document, it's a cornerstone document because we've moved from understanding the magnitude and the consequences of violence to really shifting the conversation to talking about solutions to end violence against children. So these are the 7 strategies that all these organizations together have agreed on will end violence against children. Each letter of Inspire stands for one strategy. So the first one is implementation and enforcement of laws. The second one is norms and values. The third one is safe environments. The fourth one is parent and caregiver support. Fifth one is income and economic strengthening. Then we have response and support services, and the E is for education and life skills. Within the package, we see a strong component of prevention. Traditionally, many of us have been working on the response side of violence against children, so really responding to victims. However, the public health approach brings us back a step and shows us that we need to work on violence before it occurs. So at the left hand of the slide, you'll see prevention before occurrence. That can be universal, blanket coverage campaigns, or it can be targeted to specific groups. Then once violence has occurred, we need to prevent its recurrence. And that can be by removing a child from the family, removing the perpetrator from the situation, or different ways. And then the third type of prevention is prevention of impairment. And that's really preventing symptoms that will hamper a child's life further in life. So when we look at Inspire, we see 7 strategies. Only one of those, the R of response services, is a response strategy. All the 6 other strategies are really on the left hand is prevention before occurrence of violence. So that's a very key component of the Inspire package. Another key component of the Inspire package is that it's multi-sectoral. So we have the involvement of the justice sector, of the health sector, of interior planning, social services, and education. And so for each of these 7 strategies that you see here, you'll see that we present an approach within each of the strategies, which sectors are involved, and then very concrete interventions. Inspire highlights presents 43 interventions that have evidence behind them, and so that have shown to work in different settings. This brings me to an important point, which is the third very key component of Inspire, is that it's evidence-based. So these are the interventions highlighted in Inspire are only those that have been scientifically evaluated, or those that have prudent practice, so that have had some sort of evaluation or by observation or qualitative studies to be effective in reducing violence against children. So we're no longer talking about personal beliefs or personal experience. We're really showcasing interventions that have worked. I often say it's like the vaccinations. We wouldn't vaccinate a child with a vaccination that hasn't been fully tested. And so for violence against children, we should be working towards that, where we're only implementing interventions that have been rigorously evaluated. So we've looked at the components of we've looked at the magnitude, we've looked at the health consequences, and we've looked at the components of the Inspire package. Now I want to give you some examples of interventions per strategy. I won't go into each strategy, but you can, if you look at the Inspire core document, you will see different interventions and the results they show to decrease violence against children. So the first one, the I of Inspire, is implementation and enforcement of laws. Within that, you have 4 approaches. So you have laws banning violent punishment, you have laws criminalizing sexual abuse, laws that prevent alcohol misuse, and laws limiting access to firearms. I won't go into an intervention on that because you can see that within the document. I'm just going to move on to the next strategy, which is norms and values. Within norms and values, you have different sets of approaches. So norms that are harmful, that are projects that address gender and social norms, projects on community mobilization, and bystander interventions. One of the interventions that's mentioned in Inspire is, for example, this one called SASA, which is a program in which the aim is to reduce children witnessing intimate partner violence. It was initially set up in Uganda, and it's now rolled out in 10 to 15 countries throughout the world. And basically, community workers intervene in families where there is domestic violence. And within that intervention, in a short period of time, they managed to see a 64% reduction in children witnessing intimate partner violence. So that's one of the 43 interventions that's presented in Inspire. If we look at safe environments, there are 3 different approaches. So we can either address hotspots, we can interrupt the spread of violence, and we can improve the built-in environment. The intervention that I'm presenting here, which is also one of the 43 interventions highlighted in Inspire, is one which is a reduction in violence-related injuries following implementation of the Cardiff model. This is one that could be interesting for Australia or New Zealand. Actually, in fact, I think it is being implemented in Australia, maybe in Canberra or Sydney, where they cross data from police recorded woundings and hospital admissions. Based on that, they identify the hotspots in the city. They send community workers to intervene with those that are perpetrating the violence. And within very short time frames, they've seen a 32% decrease in violence-related injuries through the police recordings and 42% through hospital admissions. So by being very targeted in what you're trying to achieve and in which part of the city and in which part of the day, you can actually see a decrease in violence against children. I'll go on to parent and caregiver support. So we see different approaches. We have home visits, we have group settings or comprehensive programs. The one that I highlight here is called the Nurse Family Program. Oh, hold on one second. In caregiver support, we see a reduction in child maltreatment due to Nurse Family Partnership Program. This was initially set up in the US, but it's also running in 15 countries now. And it's basically a system where the nurses accompany young mothers during their pregnancy and then the first few months after their pregnancy, which is what they do in many countries. However, in addition to taking their attention and weighing the baby, they will have conversations with the parents in terms of violence in the household, how they're coping with the other children in the family, how their relationship is coping, and how they're managing the first few months of being parents every time again. Within this program, we see a 48% decrease of violence against children over 15 years. So this is a longitudinal study where parents are followed, or where children are followed over a 15-year period, and they see a decrease in violence of 48%. Income and economic strengthening. Here we speak of cash transfers, saving and loans combined with training, and microfinance. There are a number of examples. The most notable one is called Image, where it's a combination of cash transfer and parent strengthening programs where they've seen huge responses on violence. In terms of the response and support services, the handbook actually, in fact, goes into a lot of detail on identification of children victims of violence, therapeutic approaches, treatment programs for juvenile offenders, and foster care interventions. I won't go into these in too much detail because they're very big chapters within the Inspire handbook, and so I welcome you to look at those chapters. The education and life skills programs, so we see the different approaches which are increasing enrollment, safe and enabling school environments, knowledge about sexual abuse, social skills training, and adolescent violence prevention. The intervention that I highlight here is a life skills program that's run across 249 schools. And when the program is targeted for all students, they see a 25% reduction in aggressive and disruptive behavior. And when it's targeted for selected students, so often the naughtiest students in the school, then you see a 33% reduction of aggressive and disruptive behavior. So we use more and more, we see that school is really a place where we can do a lot of prevention work. And when I say prevention, it's really primary prevention. So making sure that violence is not even occurring in the school. So we're addressing bullying, but also using the school as a place to work with families and communities to reduce violence. So we've seen the problem of violence, we've seen the consequences, we've seen some of the evidence behind interventions that work. As we were presenting this very quickly, we had organizations saying, but how do we do this? If we're already doing a parenting program or a school-based program, how can we improve it? You know, what are the key elements to improve it? So together over the following 3 years, between 2016 and 2019, with experts from around the world, we developed the Inspire Handbook. And the Inspire Handbook really helps us understand what is the theory of change, for example, behind a parenting program? What are we trying to achieve? What are the core intervention components that have to be part of a parenting program for it to work? What are the costs and what is the cost effectiveness of the program? What are the human resources and the infrastructure requirements? Where do we get the manuals and training programs? And what are some of the lessons learned from previous implementation? So in terms of what you should read, if you can read the Core Inspire book, which is about 40 pages and will maybe give you an idea of some of the core interventions, then once you're interested in the intervention that you would want to implement, then you can look into the handbook and find everything you need to know and access all the resources through hyperlinks to the actual guides and manuals in order to implement the program. So another key component of a collective impact is monitoring. Linked to that, we've also developed an indicator guidance and results framework, which is accessible on the website. I won't go into too much detail. It has 160 indicators, and you can look through that to see what are some of the indicators to measure whether your parenting program or whether your school-based intervention is actually having an impact on children. Partnerships, this is really key. I work for the Global Partnership to End Violence Against Children. We realize that in order to end violence against children, these different groups have to work together. NGOs, donors, professional associations, academia, UN agencies. And I really purposely didn't say government ministries because in our view, governments should be in the driver's seat of ending violence against children, just like they are for education or for defense or for economy or for any other key area. But in order for us to end violence against children, governments should be in the driver's seats and all these other actors should be across the table, and partnerships can help in bringing these actors together. The Global Partnership to End Violence Against Children works with the concept of pathfinding countries. We currently have 23 countries that range from Sweden and Canada to Jamaica, Mexico, Tanzania, Uganda, Mongolia, Japan. And these are countries that are really showing political will and where the partners that you saw on the slide before are really coming together to end violence against children in their country. We hope that Australia and New Zealand will one day become a pathfinding country as well. My last two slides on communication and political commitment. We do realize that we need to communicate clearly. If we're all talking about the same 7 strategies to end violence against children, we're much likely to have an impact. We have the Sustainable Development Goal, which is 16.2, to end all forms of violence against children. We have a partnership, which is bringing together partners, and we have a technical package to end violence against children. And by implementing the 7 strategies to end violence against children within your community or within your country, we hope to see a reduction in the prevalence of violence against children within the next 15 years in order to achieve Sustainable Development Goal 16.2. So thank you very much for information. You can find everything, the slides, as well as the handbook and the core documents on the WHO website, which is listed here. Thank you for your time, and don't hesitate to reach out if you have any questions.
Thank you, Sabine. On behalf of the Pan-Pacific Safe Communities Network, I'd like to thank you for your time today and sharing the information around Inspire with all of our communities. Thank you.